Dear patient, it's very important for me that you be empowered, that the visit that you come to me with is valuable to you. I always start my visits with, tell me what is on your agenda today. And I think that that's very important. And very often people say, oh, I have nothing. And then 20 minutes into the visit, they suddenly have 5 or 6 problems. So own that visit and control that visit and make sure that I'm aware of what you need to talk about.
Dear patient, please establish a relationship with a primary care provider. There's so much in your day-to-day health that we want you to be proactive about, looking into, sought after. And when you go to select that primary care provider, please find a provider that understands and sees all of you.
Healthcare is not a cookie cutter experience, and it shouldn't be, because people are unique, and what makes them unique also requires unique styles of healthcare delivery. What we're starting to see now are healthcare systems that are being built specifically around groups of people. For example, we're seeing TIA, which has entered the marketplace as a primary care provider for women, catering to women's health. We're seeing geriatric practitioners who are building systems like out of Emory Healthcare System that are building systems of care around people who are aging. And right here in Phoenix, Arizona, we have Spectrum Health that is a primary care that is built and designed for people identifying with the LGBTQ community and those with HIV and AIDS. But what's really special about them is they are enveloping the community at large, the loved ones and the family surrounding these people. So they truly are primary care for everyone here in Phoenix. Today, I'm honored to welcome Mark Moeremans and Dr. Grossman, who are here representing Spectrum Health, to talk today about their model and why it's so special. Today, I am so excited to bring 2 incredible guests. One, Mark Moeremans, who's been with me actually since the very beginning of building my company. I can't even believe how you've, just been here through the whole time and you've been able to watch us grow. And then I have Dr. Grossman, and they're both from Spectrum Health. And today we're going to be talking about a handful of topics, which I'm really excited to dive into. So what I'll do is I'll actually let you both kind of do an introduction, if that's okay, because you have incredible, impressive resumes. And I'd love for you to be able to cover all the things that are important to you.
Sure. I'll jump in. My name is Mark Moeremans, CEO of Spectrum Medical Care Center. And as Jasmine mentioned, we've known each other for several years now. I've been here in the Valley for over 8 years and got to spend a lot of that time supporting local entrepreneurs and founders, and watching Jasmine and people like Jasmine kind of grow their companies into these amazing, impactful businesses that are serving lots of people has been really, really exciting. And so prior to joining Spectrum Medical, I had the opportunity to help launch several new digital health ventures. I've been in ecosystem building, venture capital, investment, private equity, but I've always had kind of a mission-oriented focus. And so to be able to join as CEO of Arizona's premier LGBTQ health organization and one of the preeminent local clinics for primary care, HIV prevention, and HIV treatment with a 30-year history has been a huge honor and really exciting to kind of combine that business savvy, entrepreneurial mindset with mission and impact, which is where I had the opportunity to team up with Dr. Howard Grossman.
Yeah, and Dr. Grossman, it's like such an honor, honestly, reading your resume and all the work that you've done and the things that really set you apart. Like, oh my God, I'm just so excited to talk to you today.
Thank you. So, I'm a primary care doctor. I've always specialized in LGBTQ health, and I've been treating people living with HIV since the beginning of the epidemic. Actually, some of the first cases showed up in the hospital I was training at when I first got on the wards. So it's been a long time and seen a lot of change. Most of my time was spent in private practice in New York. I spent a couple of years running the American Academy of HIV Medicine in Washington. Done some overseas work, got to work with multiple different health systems in the LGBT space, which is really nice, and came to Spectrum almost a year ago now. It's been a really interesting journey. Mark is amazing, as you know,
Yeah.
and he has been transformative. in at Spectrum. I think we're really poised to do even bigger things than we've already done. You know, our founder is a friend of mine, Dr. Dennis Vanek, and he's been an important player in the in Phoenix, you know, helping to set up the Fast Track Cities Committee, been really involved in community activism. He's retired now, and he asked me to take over, so it's really an honor to follow him.
Oh, well, and I think one of the things that I learned about you that I hope we can also kind of dive into is your passion for letting people leave this world in a way that feels honorable for them. And just based on your experience of what you've seen and worked with in the past, there's a need for that. And I think the premise of this podcast in general is to talk about things that maybe are common to us that we see and we know that we just wish other people would know about or hear. And I think, you know, this topic of HIV and AIDS, you know, even in healthcare, I think sometimes there's still like this element of taboo to it. And we're afraid to talk about it with people. And we have to get over that hump so we can help work more preventatively and educate and also support, because the thing about healthcare is it's not meant to be done alone. And so even though you're treating the person, you're also working with their family and treating their community around them, which is so important too. So I'm just curious, like from your perspectives, you know, if there's one thing kind of that you would love people to walk away with today knowing, like what would that be?
I would say what I've always tried to push and to model is that healthcare is a partnership. As you said, it involves a community. It, you know, even just one-on-one, it's a partnership. I can't do this alone. The patient can't do it alone. We have to do it together. And I really believe in patient empowerment, and that, you know, that's always been something I believed in. But then through the HIV epidemic and the worst years, I was involved with ACT UP in New York. You know, those were really important learning experiences for watching people take the control of their healthcare into their own hands, not sit and wait for other people to take care of it. You know, on the end of life stuff, you know, we're all going to die at some point, right? How we do it is the question, and we don't do it well in this country. When you look at people, for example, who are referred to hospice, they're usually referred 48 hours before they die. And really, they should be referred as soon as they have a serious illness. Hospice is such a great movement. But there also comes a time when people may choose their own way out. And that's something that I, you know, with those experiences of watching people die, horrible deaths from HIV, something that I very strongly believe in, a patient's right to choose. I was involved in a Supreme Court case back in the mid-90s about assisted dying, physician-assisted dying. Now, we won in the New York State Legislature, and I ended up on the front page of the New York Times, and a friend of mine who was the editor said to me, "That's the only time your name's going to be over the fold."
Little did they know.
And then he gave me the plate they used to print the paper that day, which is still out. But it was a real honor to be involved with that case. And it's moved forward. And in New York, actually, just a couple of weeks ago, the governor signed a bill allowing people to choose the right to die. And so that is part of that patient empowerment thing. One of the first doctors I worked with when we were dealing with the worst years, when there was no treatment, said to me, "Your job isn't necessarily to keep people from dying. You do the best you can, but at a certain point, your job is to make it easier than if you hadn't been there." And I think that's such a lesson for caregivers, not just for providers, but for caregivers, that, you know, your job is really to help people transition in the best way.
Yeah. And I love that you can really appreciate that. I think kind of what I witnessed as a nurse, right, is we see, you know, doctors are trained to like save and save and save and save. And I wonder oftentimes if doctors feel like they're a failure if they don't save, because that's what you're like really like programmed to do. But there's this like flip of mindset in knowing that sometimes saving looks a little different, and it could be saving them from unnecessary suffering,
Exactly.
right? Them and their family, who's also watching them go through something, because it can be equally traumatic for the family as it is for the person.
Exactly. But I always try and remind families, you're not the one on the bed. Okay.
Yeah.
You know, it's the patient who has to make a decision about what they want. And, you know, I try very hard to get people to make sure they have advanced directives in place. It's one of the efforts we're making right now, is to make sure that all of our patients, from whatever age, have a medical proxy and make their wishes known. We have a thing called the 5 Wishes. It's something the American Bar Association started years ago that lets people do that without a lawyer. And we give that to every single patient. I mean, here we are in Phoenix. I mean, car accidents every day. How do you know if you're 20 years old, you don't know what's going to happen to you? So those things are really important. But again, it's about patient empowerment. It's about partnership. I mean, that's really where it is. I always say to patients, look, I want you to be honest with me. If I want to suggest that you take a medication and you don't want to take it, tell me. I'd rather not write the prescription. If either I haven't explained it well enough, or you've made a decision that you want to go in a different direction, that's fine. I need to know where people are at.
Yeah.
You know, and I try very hard to keep my ego out of this. You know, like you say, I think doctors too easily feel like failures when things go bad.
Yeah.
And that's a hard place.
I can't imagine what that must feel like, but I really applaud your work on integrating that. And you have a primary care clinic, so I'd love for you to chat more about that too, because being able to integrate something like this in a primary care clinic where people are coming in and they're receiving just standard care, like being able to talk about your wishes. I think even especially in a primary care setting where there's nothing imminently life-threatening potentially, right? Like you're just kind of coming in, you're in a different frame of mindset. But yeah, tell me a little bit more about the primary care. I'm really excited to hear about it.
But you're in that setting, and how often, we were talking about it last night, how often I hear, oh, I hate going to the doctor. Why should you hate going to the doctor? Why shouldn't it be a good experience? Why shouldn't it be a place where you learn, where you share? We do a lot of sexual health. So we are going to ask lots of questions about how people have sex, or that they're not having sex, or what's going on. We try to learn as much as we can about people. And the big challenge in medicine these days is that everybody's rushed. Okay.
Yes.
We have plenty of places where people have 15 minutes or 20 minutes, places where they have 10 minutes. So that creates a challenge. One, you got that computer between you and the patient. So how can you create systems where you don't have that? How can you use technology, scribes, things like that, where you can get back to actually talking to a patient? How many places where a patient never gets touched? Okay. Now, do we have to examine every patient? No, not necessarily, but that touch creates a bond, and it's what people expect. And it doesn't take that long to make that extra effort. But there are plenty of providers that never touch the patient. And, very often you're not going to find something, but sometimes you do. So those kind of things, but using technology to create more partnership, letting patients fill out information at home and having it download into the chart saves an enormous amount of time and lets you spend more time talking to a patient. I mean, those are tools that we're trying to use at Spectrum to improve that patient experience and to make it more personal, I always say, we want the feeling of old-fashioned care with modern tools. And that's really what it is, I mean, I used to give a talk called Putting the Magic Back in Medicine. So if you think about medicine,
I love that.
120 years ago, they had no antibiotics. They had they gave people ridiculous things to treat, arsenic to treat syphilis, things like that. But there was a magic in the patient physician bond. And we've lost that in the world of technology. And how do we get that back? And so people then turn to magic. I believe in traditional medicine. I think traditional medicine, traditional Chinese medicine, for example, has been around for 5,000 years. I mean, so there's things that it does that well. But patients will go to a traditional provider and come back to my office with a bag of black rocks. And I say, well, tell me what's in it. They have no idea. Okay. I mean, I can look that up in books of herbal medicine and see if there's drug interactions, but they have no idea what they're taking. But it's that magic. That's the trust that they give that person. And that's what we've lost, I think, in a lot of medicine.
To your question on primary care, I think that we're in an interesting kind of inflection point in our history and society around how we deal with healthcare and medicine. And I think that primary care has been a victim of some of the changes that have happened, where many people don't have a primary care doctor. Many people substitute urgent care for primary care, or we've over specialized every component of our health to a dozen different providers. And so you lose that relationship with different people. And so one of the things that I think is so exciting at Spectrum and important around primary care is that it's very comprehensive. So we talk about LGBTQ health, we talk about HIV prevention and treatment. Those are a part of your overall primary care. In the same way that historically women getting on the birth control pill would have to go to a gynecologist, or would have to go to an OBGYN. That's primary care. People are going for diabetes treatment or hypertension or blood pressure and all of those other things. That's primary care. And I think having a trusted source who knows you, who knows your health, and who incorporates your lived experience, your identity, and all of those pieces of you into your health plan is something that we try and promote and do, so that when you go to the doctor, you're not just going for one piece, and you don't have to segment yourself across many different pieces. And so when I think about, what I want the audience to kind of get from this, there is a push for, having a primary care provider, but also understanding that our healthcare system was sort of designed with a very specific patient in mind, and a very specific process on how to move that patient through a system. And that box does not fit everyone. And I think there are places like Spectrum and peer organizations that expand the definition of what that box is, or have created kind of an alternative box for people who don't fit into the traditional kind of system of primary care or system of medicine. And so I think that we've been trained to believe that we have to make trade-offs, or I have to hide this part of myself, or I don't get to show up as my full self, or I don't get to ask these questions or receive this type of care or receive a lesser version of care because I have to fit into this box or process that was designed with someone else in mind. And so what I want people, watching or listening to know is that you don't have to make that trade-off. There are places that you can go to that understand your unique identity, lived experiences, orientation, demographic, whatever it might be. And that's not just for LGBTQ individuals. That's, Black women have very different stats and outcomes in the healthcare center because health was not created. The process was not created with Black women in mind.
Yeah.
And so I think identifying partners and providers and clinics and clinicians that understand your unique identity and the needs, the healthcare needs associated with that identity, is really, really important. And reminding people of how critical it is to have that relationship with a clinic, with a doctor, with a provider, because when something does happen, you don't want to go to someone for the first time who has no idea about your health history, who has no idea how you respond and interact with certain drugs or treatments or medications, so that you've built that kind of trust and relationship with someone in the event that something catastrophic might happen.
And, I think those are such important points. And I always say to people, you don't want to go looking for a doctor in an emergency. Okay. If you have an established relationship, you can get in pretty fast. If you don't, you might be told we don't have an appointment for 4 weeks. I mean, because systems are so overburdened. And I think, to Mark's point, our reimbursement system has focused on procedures. So surgeons, people who do procedures, specialists are where the money is. So I have worked in large health systems where the primary care doctor was basically given very little time and was meant to push through referral.
Yeah.
Now, as Mark said, primary care, you should be able to treat hypertension. You should be able to treat diabetes. You should be able to at least start these things. You should be able to start HIV medication. You should be able to do PrEP. Okay, if it gets complicated, there are specialists. And within Spectrum, we have some providers who, everybody can start medication, but we have an infectious disease doctor, we have me, the people who've been doing HIV for a long time, who, if there's complications, we can take care of it. And we refer out when we get very complicated cases. That's the proper use of a referral. That's not the way big systems are working these days.
Right. And it reminds me of a few things. So like as a woman, I look at clinics like TIA as being like, this is amazing. It's a place for women to go to get care, because women too are often dismissed, and there's a lot of gaslighting for women in healthcare. And we know that when people are given care by practitioners who look like them and talk like them and have the same lived experience, that they have better outcomes. And so knowing that like you've created this incredible organization that really is hyper-focused, in providing the best care, I'm curious if you've seen like different outcomes in the clients that you care for.
Well, I mean, that's actually an important point. So LGBT-focused care is very patient-focused, okay? And that's sort of the mantra in medicine these days is focused care like that, treating the individual. And we do that with everybody. So we create this safe space. When we create it, it's open to everybody, okay? So when I had my practice in New York, I would start basically with an LGBTQ base, but then people would refer their parents or their brothers or their sisters or their friends, and and the practice grows. One of the initiatives we're working on right now is what we're calling a queer women's health initiative. When you look at the spectrum of the LGBTQ plus communities, and they are communities, there are different needs there. The L and the B often get ignored. Everywhere that I have been going the last bunch of years, I ask, well, where are lesbians going for care? Nobody can answer. And many of the women that I speak to say they've had very alienating experiences with healthcare. Mm-hmm. Like you said, a common experience for women, magnified for lesbians. So we are focusing on queer women, and that includes non-binary, our transgender patients. And if we can create a space that they enjoy and that they feel comfortable in, it seems to me any woman would feel comfortable. But we start with our core focus and then hope that it grows.
And something I like to remind people is that there are very real health outcomes to that different approach in care. And so when we think about LGBTQ health or women's health or queer women's health, for example, the standard of care in most places for STI testing does not include an oral or an anal swab. And so a lot of STIs actually get missed, and
70%.
Patients, 70%.
Yeah.
And so patients are told, you are STI free. And believe that they are in good health and can go on continuing to potentially spread STIs. And so that's because we understand personalized care, and we're more sexually open-minded maybe because we see a broader spectrum of patients and orientations, that there is sexual activity happening in other parts of the body that also need to be screened and tested for those things. And so when you go to these preeminent and premier hospital systems and other things, and they're providing a different standard of care that is missing some of these things, that says, well, wait a minute, my patients weren't thought of in this process and are now receiving a lower quality of care because they weren't centered and their lived experience wasn't centered in this experience. Yeah. That same thing plays out again. We see queer women have higher incidence of breast cancer rates. They're not getting cervical screens. It's, as you know, very difficult to get diagnoses of different kind of cervical or endometriosis or things like that. And so there's all sorts of data that highlights the difference in health outcomes. And so this personalized, focused care isn't just about feeling good. It's about making sure that people within our community are receiving the highest level of care that they should be expecting and demanding from everyone, but oftentimes goes overlooked. One other thing that you mentioned about TIA that I think is really interesting for people interested in kind of the patient experience. I think TIA is a great example of kind of a person-focused, a woman-focused health clinic, but they're also one of the pioneers in sort of translating the healthcare experience to almost this consumer positive, that it's more than just kind of the clinic, right? And so Howard and I mentioned we don't want Spectrum Medical to feel like just another clinic or it's sterile or no one likes going to the doctor. And I think Tia has done a really great job of taking their core audience, women, and saying, what do women expect from an experience where they're going, where they're putting a doctor? They want the robe, they want kind of the soft lighting, they want to feel different. And we hear all the time about kind of white coat syndrome, where your blood pressure might spike when you're in a doctor's office. And, you know, the white countertops and the white walls and the white everything is not helping with that. And so I think that there's a real interesting movement in healthcare today of how do we kind of match the patient experience with the consumer experience of what we've been trained to look for and accept in our hospitality groups, in our apps, in our homes, and these other things. And moving a little bit away from this sterile environment that medicine has been known for so long.
Yeah. Are there any initiatives that you're taking at Spectrum to really kind of, mirror that?
100%. So I'm super excited. Spectrum Medical recently signed a new 10-year lease at an expanded facility right around the corner from our current home.
Okay, so which is where?
So we are currently located at 52 East Monterey in Phoenix, and we'll be moving to 3003 North 3rd Street. So literally right around the corner.
Okay.
We are tripling our exam space.
Wow.
And so we've got room for patients if you'd like to check us out. But as part of that, we'll have 22,000 square feet. And we're doing kind of a big remodel to make sure that it looks and feels, one, like Spectrum Medical and not whatever doctor's office and clinic was there previously. And two, that it fits kind of the needs, the vibes, the desires of our patients. And I would say, for better or for worse, patients judge their medical experience first with their eyes. And so I think whether they're receiving the best quality of care or all of these other pieces, there's a component around, as humans and human nature, how we evaluate something. We use all of our senses, right? And that first sense that you walk into a space with, we want to make sure that, there's soft surfaces and color and all of those other things to make people, one of our mottos is feel good here. And so we want to make sure that that's brought through in a way. And so much of what we do at Spectrum too is community efforts. We do a lot on public health. We've got mobile units. We do public health testing. We're out at different events. We do telehealth with providers on site. And so we also want to have space in this new building that incorporates that community feel. And so if there's organizations or groups that want to come and host events in that space, or if we want to do lecture series or lunch and learns or community events, I know there's a lot of great groups in town that do kind of living with HIV and support groups and things like that. We can host those in our facility. And I think we have a responsibility as an LGBTQ-centered health environment, and we see this in cities around the country, to be sort of a center of excellence, to be a focal point, a gathering point, and a community point. And I think there's this growing solidarity as a community here in the Southwest that's taken a little bit longer from our coastal neighbors to generate. And now we're looking for those spaces, or we're seeking out that community, or we have enough pride in ourselves and in our peers and neighbors to want to come together under that shared banner. And I'm excited for Spectrum Medical and our new facility to kind of be one more piece in the puzzle to contribute to that.
And the thing is, it doesn't cost a lot to create that environment. One of the things I think, truthfully, is the idea that, when you look at some of these big hospital systems and you go into their clinics, you got ugly, uncomfortable chairs. The walls are painted yellow, which makes people look awful. It's low level care, and poor people expect. One of the reasons I work all day, I will tell you the story real quickly. So when I was, before I went to medical school, I worked in a lab, and the first guy I worked with was a hematologist, and he ran at Einstein, the Bronx. He ran a sickle cell clinic across the street in big city hospital, Jacoby. And twice a week he had a clinic there, and he said to me, "You have to wear a tie." And I said, "Why? You're the doctor. I'm not working." He goes, "Our patients don't have a lot of resources, don't have a lot of money. They expect bad health care. If you don't look the way their concept, now this is back in the 70s, if you don't look at the way their concept of a doctor, it just reinforces the idea that they're getting bad health care. And those settings that are so ugly reinforce that for people. And I think, why not elevate everybody's experience of healthcare, no matter what their resources are? I think that's really important. Now, I don't expect everybody to wear bow ties. It's my drag, and I have fun with it. But you know, part of it is that creating that image to help people feel more comfortable.
Well, and I think it probably helps you just as much as it helps the patient, because there is something to be said about how you show up in the world, right? Like if I decided I just wanted to come in yoga clothes today or whatever, like it affects how you show up as a provider, I'm sure, and just like no matter what it is that we're doing, like how we show up in the world. And I think that's beautiful. It just shows like how much integrity that you really are mindful of how you show up, and the small details matter for people, the lighting, the touch, how everyone presents themselves.
I mean, you have a beautiful uniform, right? It has your company name on it. It says who you are. And I think that communicates itself to patients.
Yeah.
And it's a wonderful color. I mean, that is,
Thank you.
helpful too.
It's not the stereotypical like the seafoam green and the traditional that surgical feeling. It probably gives people white coat syndrome originally.
I wear a white coat actually, but that's because I like pockets. I like pockets and I like to keep my clean.
And sometimes offices are cold.
Yes.
I always get cold. Really, hospitals are worse.
You need the coats to stay warm for sure. Oh my gosh. So really what I'm hearing is that like you're creating a very safe place for all people. And I love that, you may start with someone who's LGBTQ and then they bring in their family members, because if they feel safe there, then their family is going to be like wowed probably. And just like that mention of, the STI screening, I spent part of my last 8 years at Mayo Clinic where on a neuro ENT floor. So we took care of a lot of people who had head and neck cancer. And so many people were so surprised about the HPV. And this is what caused the oral cancer for them, but they had never been screened properly for it. And you just think about how many people are potentially being missed along the way because we're not instituting the right things, where you're taking a really holistic perspective, like talking about things like sex, which like we don't really talk about, and it's really important too, because that's part of who we are. And when you have a diagnosis, like even if it's something like diabetes or heart failure, like we don't talk about sex with people who have heart failure, and that's a really big deal for them, right? It's really significant. And so we're missing out when we don't have those conversations. And so thank you for like really seeing the whole person, because that's what it sounds like you do.
I mean, I will tell you, I had an experience years ago where I was talking to a 72-year-old woman, and I took this sexual history, and I told her I did this on everybody. And she was so grateful. She said, look, I'm 72 years old. I'm a widow. Nobody's asked me about my sex life since before I went through menopause. I'm dating again. I don't know what to do in this world of HIV and sexually transmitted diseases. And I opened that door. And I think that's the thing. Providers need to be the one to open that door, and then let people walk through in whatever way that they wish.
Yeah.
And that's really important. But she was really grateful, because when you think of those days, this is 30 years ago, when she was growing up, you used condoms for birth control. Okay, she's 72. She doesn't have to worry about getting pregnant, right? But we saw tremendous amounts of HIV in nursing homes and STDs, and it's still going on.
Yes.
Because those people have not really had any education on what to do at this point in their lives.
I think that's actually an issue up in Sun City, like a lot of the homes there in it, and I think that's because of we're not talking about it, and then all of a sudden you just have all these older adults in this community, and there's a bunch of them living in a space. It's kind of like the dorm all over again.
And everybody wants to talk about
Yeah.
sex. Everybody wants to talk about sex. I used to give lectures to some of the pharmaceutical company reps, and I would go in and I'd start talking about sex, and the hands would shoot up. I mean, the executives were freaked out, but people were so happy to be able to ask questions that they hadn't been able to ask before. It was always kind of an amazing experience.
Well,
Yeah.
I think it speaks to, broader kind of cultural trends and streams and how that impacts health, both individually and public health, where, as a society, we're not very good at talking about sex. And so
No.
that translates into policies about sex. It translates into education curriculum about sex. And all of that is happening over here that says no one has certainty or clarity around it. And at the same time, our providers in most primary care settings aren't equipped or trained or comfortable asking about it, screening for it. And so what does that happen? That leads to an information gap.
Yes.
And in that information gap, disease can spread. And whether that's STIs, whether that's HIV, whether it's something more minor than either of those things, it still spreads. And so we've got a duty to our community around education and advocacy and public health and all of those other pieces. But I think bringing that into the primary care experience and normalizing it, we talk a lot about stigma, destigmatizing any of those things. Like I try and be very vocal of like, I've been on an HIV prevention pill for over 10 years. That's a part of primary care. I don't think twice about it. And it just is a part of my daily routine. I think that energy or that idea of like, why shouldn't I be able to talk to my primary care doctor about it? Or why wouldn't they be prescribing me those things? It's just one more item. Your reproductive organs and your sexual history is just one more piece of your overall body, of your life, of your health. And so it should be treated with the same kind of time and care as all of those other body parts and pieces and
Tell the
destigmatized.
story that when you moved to Phoenix, you couldn't find somebody who was willing to
Yeah.
take PrEP.
And so having lived in New York and Boston and San Francisco, I joke with people all the time. I mean, they might as well put PrEP in the water there. It's very common. You go to a doctor. Yes, I've prescribed this 100 times. And when I moved to Phoenix over 8 years ago and was looking to find a doctor who could, get me on PrEP so I could continue kind of that prevention tactic, I got a lot of questions and providers were not familiar with it. They weren't comfortable prescribing it. I was made to feel a little bit weird for asking for it. And it really surprised me. And I think that's what, one, a place that like Spectrum that has that cultural competency and that inclusion and comfort. But two, when I think about kind of the stigma or the normalization of those things, even recently, there's this brand new, it was FDA approved last June, long-acting 6-month injectable PrEP. So instead of a daily pill, you can now move to a 6-month injection. I tell people it's like moving from the birth control pill to an IUD.
Yeah.
I asked my then primary care doctor about it and they had never heard of it. And so there's no worse feeling than having to educate your care professional about advances and breakthroughs in medicine or kind of asking for treatment. And so they say, oh, I'll look into that. But there are places, again, this goes back to kind of who health is designed for and where their expertise lies and things like that. At places like Spectrum, we're on the cutting edge of those types of drugs and breakthroughs and all of those other pieces. And so I got my 6-month injectable for the first time last week.
Congratulations.
Thank you.
Okay.
And was very happy to be a patient at Spectrum.
And got mine in October. Almost in for the next one.
And so it's been exciting to kind of be a place that is so kind of on top of those things that destigmatizes it. And I just imagine, Phoenix is one of the fastest growing metros in the country. I used to work in economic development. One of our favorite stats was something like 300 people a day were moving to the Valley. Mm-hmm. And so imagine, some percentage of that number is going to say, where can I get on PrEP? Where's the LGBTQ health organization? I'm living with HIV. Who do I need to go to? And I think what I want people to know is like there are places, and it doesn't just have to be Spectrum Medical, although I would love that. There are other places and peer organizations doing great work that specialize in that. And you have choices as a patient of where you want to seek care. And there are great places out there. You don't have to sacrifice quality of care for care that understands all of you.
Yeah. And I think just kind of like adding to what you said earlier about a partnership. And I think as healthcare consumers, we have responsibility for our own health, that we choose the partner that we can develop a relationship with. And that's really important. So like for me, in Navi Nurses, what we do is always try to give people the resources and let them interview, let them decide what feels right for them, because only the person knows who is the best fit for them as their provider. And just like, I know that's one topic we talk about a lot, is just encouraging people to continue to seek till they find like the person that they can find that sense of security with, the place. And that's really important, because when you can feel safe and secure, you can be open and honest about things and feel like you're not being judged and there isn't the shame. And you're just so much more like free flowing with everything, which is important. We want people to be open and honest about what's happening in their lives, and that's how we best support them.
Right. And what there are several things I really like about Phoenix. I mean, about Spectrum in that way. So one, for example, with our health initiative for queer women, we're men. I may be able to say, I've heard this story. I think we need this. It's not my lived experience. So we are forming an advisory board of women to tell us what this needs to look like. We hired a gynecologist who's a woman who's working with this group, and we try to be humble about that, but we want that community involvement. And many of our staff are very involved in the community. We sit on boards. We're involved in the Fast Track Cities. We have people who do some of the youth camps for LGBTQ kids. It's really been exciting. And the other thing is, we don't have to compete with everybody. We support our colleagues who are doing the same kind of work. We can't take care of everybody in the world. There's plenty of patients to go around.
Yes.
There's no reason to be competitive. We think we're the best, which is great. But that's a patient's choice. And like you said, and they need to find the place they're most comfortable with. And why shouldn't we support other people in this space when it's such an important work to be done? And I like that about Spectrum, that we have that feeling for community.
I love that. And I know you've just kind of gotten to know a little bit about what we do today as well, but
I'm going to send your patient.
Good. We look forward to caring for them. And we have nurses that are part of your community that work for us, and for me as an employer, being able to create a place where they feel safe has been it's been amazing. I love that. But it also means that we've been able to care for people in the community as well, the LGBTQ community, that they feel safe with us. And that's magical to watch when you see it, when someone feels truly seen and heard and accepted. It's so powerful. And thank you for really providing that space for people in the community here.
I had a patient last week, very interesting, who's HIV positive. His husband of many years died last year. And he has never told his family, the people who, including his brother who has his medical proxy, that he's HIV positive. And he's been positive for many years. But there's still that stigma and that fear. Even the person who's supposed to have his medical care in his hands doesn't know. And so the space you're talking about that you provide, I think, like you say, it makes a huge difference, and it opens up people to be honest, which is so important in treating and preventing disease.
Something that also just throw in, that you've always done an awesome job with Navi nurses of, and dear patient, something you should know is that our healthcare providers, our clinicians, our doctors, our nurses are not okay. It is very hard out there to be working kind of on the front lines. They've been abused, and going back all the way to COVID at this point, but things haven't gotten much better. I mean, the patient numbers that they're expected to see, the time that they do and don't get to spend with patients, the time coding and billing and the administrative work behind it, it's a very difficult field. And I think something that you've done an amazing job of at Navi is, highlighting and centering the dignity of nurses and the profession of nursing. And I think something that, patients you might look for in where you seek your care is, how are those employers treating their clinicians and providers? Because ultimately that rolls down to the care that you receive from them. And so I think you've made Navi nurses such a desirable place to work. And I was talking to some other friends of I've thought about applying to Navi. I wanted that level of care or that level of flexibility or those other things. And we've done a lot of efforts at Spectrum Medical to make sure that our clinicians have tools and systems and process and resource and culture and values that support them. And I think that translates into quality of care for patients. But I think it's important that people realize that's maybe not the norm. Yeah. And I'm sure, I'd be curious your experience. We get a lot of providers that are starting to reach out to us through word of mouth. Like, are you growing? Are you like my current workload is untenable. I can't do it anymore. Or the metrics that we're under, the pressure that we're under is we would love to come and join an organization like yours. And I imagine you get a ton of people that are looking for kind of greener pastures because it's gotten so bad out there.
Yeah, and so I know when I first met Mark, we had won a $1.5 million grant from the American Nurses Foundation to study our work, because really quickly I saw that the nurses were happier. And I had physicians at the hospital who were like, I can pick your nurses up from the other nurses. Like, they could tell a difference. And I was like, there's something really powerful here. And so we actually studied them using the Maslach burnout inventory, which is like the gold standard of understanding burnout. And what we found is that our nurses who work for us, who more than not, they actually work in a hospital. They do this on the side. So they're working more. They are actually less burnt out. And when we interviewed them and sat down to learn like what it is that they love connecting with people. They talk about, like, in the hospital, they don't have time to be present. They can't do what they think that they wanted to do, or they knew they needed to do, but they didn't have the resources, the time, or it's too chaotic. And the stresses of the workplace itself are limiting the humans from the potential that they know they have and what they can contribute to people. And it made me think, just, like in the hospital, I would leave my shift and there'd be like 12 things at the end of the day of like, oh my God, I missed this. I got to this late. And there would be all the things I didn't get to, or I got too late. But now with this sort of care where it really is one-on-one, you're like, oh my God, I did this for them, and I did this for them, and I did this for them. So it's just an entire flip again of like the mindset. So that's what we get to see. And that's why nurses, like, we haven't really focused on recruiting them, because they're coming just hearing from other nurses who get to work for us. And I that's my philosophy. If I take care of the nurse really well, I know that they'll take care of the clients really well. And that's where we start from.
And nursing is so important. Not just for this podcast, but, nurses have never gotten the respect they deserve. And they're such an important part of the healthcare team. And when we look at it, when I first started training, nurses in New York were not allowed to do very much of anything. And over the years, nurses have been tasked with more and more and more things, the same as pharmacists. Yeah. We expect more and more and more out of them, and they are tearing their hair out, and people are burning out. And I think we need to figure out a way that we can fix that, because nursing is such an important field. And as a doctor, we sort of go in and out. Nurses have more continuity with people. It's just, I think, a whole different emphasis in so many ways. But I do think we've overburdened nursing in ways that aren't sustainable. And I think you saw that in New York with the strike recently.
Yes.
There's a breaking point. But all this, a team approach to medicine to me is the best. Before the HIV epidemic, what I was going to do was geriatrics. I did a elective at Mount Zion in San Francisco, which doesn't exist itself anymore. But they had a fantastic geriatrics program. It was the first time I ever saw a team, and it was nurses, psychiatrists, social workers, pharmacists, the physical therapists, and yes, the doctor was the chair of the team, but it was a real group effort on every patient, and it made such a big difference.
It does. And when we can all work together, that's where the magic happens.
Exactly.
Truly.
Exactly.
When I think about burnout and some of the things that you're mentioning, I think it's also worth reminding people that healthcare is one of the most political items in our country today. Mm-hmm. And for patients, a lot of times when they experience friction in the doctor's office, it's actually because of policy choices or insurance choices or these other things that were decided hundreds of miles away. And so when I think we were talking to a physician yesterday who was expected to see up to 24 patients a day in a primary care setting. And how much time do you think that they're able to spend with any of those patients for 24? By the way, you then have to go and close the note. You have to fill the scripts. You have to do the refills.
Try to get to the bathroom.
Yeah.
Who has time to go to the bathroom? Or eat lunch, right at your desk while you're working.
Or we've had patients call us frustrated of like, well, how come I didn't get my prescription refill? Or how come I got this bill? And I think a lot of physicians and nurses and primary care clinics are the front line of choices that they're not necessarily behind, and sort of are receiving kind of the ire and anger of a public that may not understand that the things that they're actually angry about were decided by very, very different people. And so we see this all the time with billing disputes or other things, which as your partner in this, like, we want to help you fix that. We want to make it as smooth as possible. We'll fight on your behalf, but sometimes we don't know these conversations that are going on. We don't know what mail you're receiving from your biller, your insurance. And so it's this interesting dynamic where I think a lot of people feel at odds with their provider because their provider is representative of this system, even though that they're just trying to deliver care on the one end of it and fit into what all of these other rules and processes that have been established.
Yeah.
And so I think what's happened is the most successful groups or patients that have the best experiences are looking kind of adjacent to that system. So when I think about Navi nurses and home healthcare or concierge health or clinics that provide a number of other services that can help with kind of the ratios and timing and all of those other things, it creates a better experience. And
Yes.
so I think we're all fortunate on this couch to have either business models or structures or revenue streams or things like that that give us a little bit more leeway so that we don't have to see 24 patients in a day per provider, because that's crazy. But I think kind of just reminding listeners that there are these structures at play that are dictating a system that the provider that you have that relationship with, the partnerships that you're building, are just kind of a cog in that bigger wheel. And it can be very frustrating for those cogs also to exist in that bigger wheel. And those frictions that sometimes I think people experience, we don't want those either.
Right. So just to add on to that, like, last little point here is that vote responsibly, right? Like, the best thing that we can do as consumers is to vote for people in office who understand what's happening in healthcare and they care about it, right? They want to see Medicare that can care for aging adults. We want to have policies in place that everyone has equitable coverage, and we want to see building of hospitals and in areas that are more rural or bringing in more advancements. So super important there. I know we're like kind of running over, but this has been an amazing conversation. I thank you both so much. Thank you for being here. Just what an honor. Thank you. Thank you.
More to come. Yeah, I'm excited
we'll
for
have
more
you back.
conversation.
We'll have you back. Yeah. What's so special about today's conversation is really touching base with the fact that people deserve human-centered care. And that begins with an experience where you have a physician or any other member of your medical team that can sit down with you, be fully present, ask you the questions that they need to ask, listen deeply, and also create a holistic perspective using all the diagnostics and tools that you really need and sometimes are being missed in our current primary care models. At Spectrum Health, they're doing exactly that, and they are lighting the way for other models to continue to follow. And with their collaborative spirit, they are spearheading a movement here in Phoenix. And we look forward to seeing how they continue to transform our community's healthcare and how it is received.